Thank you. Is that working? Try that better. Yeah, right. So one of the things we've heard about today is about, and Alan articulated, that we've got some issues that we need to think about in terms of how we use that public purse better. How do we make sure that we have sustainable services across our local community, but also recognising that not all of our services are within the confines of our geography of Hertfordshire or even East and North Hertfordshire. We know that patients over at this side of the county very much go to services both into London and into Essex. So at the end of last year, some guidance came out that suggested that we ought to look at how systems could better work together over a 5-year period. And they came up with the jazzy title, Sustainability Transformation Plans, or STPs. As you know, if you've been sitting in these meetings, we're really good at acronyms, and this is a new one for you. Somebody said it's the name of an oil way back. I can't quite remember that, but so we have an STP footprint called Hertfordshire and West Essex. And so we're very busy trying to work through how do we use the money that we're going to be able to have over the next 5 years in a way that will deliver the best outcomes for patients, but also make sure it's an attractive place for people to work. It's a way that we can care for people in the best way that they want, at the same time recognising the huge pressures that are on both the NHS purse and social care's purse. And we're trying to do this with a huge number of organisations that you'll see listed at the bottom of that. So it's an interesting journey, and we're only really starting on this. We're developing the plans now. We look to be able to publish those towards the autumn. And so this is the first opportunity we've really had to be able to start to share some of that work with you. And hopefully you'll be inviting myself or others to come and talk to you about those plans as we go through. So, as Alan and Beverly mentioned, there are some challenges here, some of which are good, i.e. people are living longer and people want to live in their own homes, and that we are having more specialist treatments available to people, but that comes at a cost. And as Alan said, £92 million if we do nothing is the gap for us as a CCG, but if we multiply that across the other partners within the footprint, then we're talking about even bigger numbers. But what we need to be recognising is there are some opportunities by working across that footprint to be able to do things in a different way. And some of that is about that prevention, that how do we look after ourselves better, how do we join up services, as Norman alluded to, and how that improves care and reduces duplication. So we have a real ambition to actually take ourselves on the journey that we've already been on. We've already talked about how we're integrating primary and community services, but we want to do that better. And we want to do that alongside our community colleagues and our hospital colleagues in a way that it isn't about one silo versus another. It's about everybody working together across mental health, physical health, children's services, adult services, in a way that gives people the right care at the right time, first time, within the available resources. And this has to be about putting people right at the heart of this and looking at how do we wrap care around, but also have, if you like, a compact and a relationship with people to help them look after themselves. So if we start off with how do we prevent some conditions like diabetes, heart disease, it is about obesity, it is about smoking, it is about activity levels, and it's about, as one of our local council colleagues talked about, how we work together to make sure that people can live well. Then it's about, if you do have a condition that needs support, how do we help you live well with that? And what can we do to help you avoid crisis? How do we make sure you've got a really good plan for your care, and what you do need to do if you have a crisis? And when we talked about the frailty car, how do we make sure that we can keep you at home safe? So we've mentioned that prevention and self-care agenda. We also need to recognise that we need to look to ourselves. We are one of the biggest employers in the county, if you look at all of the NHS and social care organisations, and we ought to include our voluntary sector partners in that. How can we make sure that we are able to give care as much as we can and save some of those days that are lost? But those of you that see me standing up around the health and wellbeing strategy will know we're absolutely passionate about working together in terms of starting well, developing well, living and working well, and ageing well. And what are the things that we can do together to be able to improve our own health and wellbeing, but also to be able to support those who perhaps need more help to be able to live well. So we've talked about our rapid response, we've talked about integrated care, we've talked about how our primary care colleagues are working in their localities to do things differently, because if we have workforce pressures, how do we work smarter? So if our GPs have special interests, how can we share those across a natural community of a locality or a town? How can we use some of our more specialist pharmacists to provide additional support for that? And clearly some of the work that we're doing around the voluntary sector is joining that up. So we have Hills going out and talking to people about a wide variety of conversations, not just about giving them their dinner. And how do we feed that back into the care planning process? We have the fire brigade not only doing safety checks around alarms, but then having a conversation to pick up whether that person's feeling isolated. And does that link into Heart's independent living service, or does that need to go to the GP, or does that need to go to Heart's Help? So we're trying to join up those dots to make sure that we know the people in the community that are the most vulnerable and that we're actively managing their care in the most effective way. We've mentioned stroke as a service that we needed to be able to give improved outcomes for patients, and by doing things differently we're starting to see that improvement. And there are more things that we need to be doing. There are some services, both at East and North Hearts Trust and at PAH, where they are vulnerable in terms of not necessarily having as many consultants to be able to deliver the care that they want, or that they're having to find it difficult to recruit, or between the two of them they've got a bit of a service, and if they joined them up, how might that be more effective? Not necessarily changing where the services are delivered, but actually looking at how they deliver that care through perhaps a more partnership way of working. It has to also link into how do we reduce the demand in hospitals when we know there are alternative services that could better look after somebody, and how do we have that conversation with people about those alternatives and linking up. And so what we've been doing is very much looking at those the evidence for where we have variation in services and how do we improve that. How do we make sure that we have the best quality outcomes irrespective of where you go, and therefore what are the pathways of care, and how do we make sure that they are as standard as possible, so it doesn't matter whether you go to Lister or whether you go to PAH, but you can expect the same outcomes. So we're trying to look at how do we build, if you like, the bridge or the activity that we need to do to be able to reduce that gap. And it's not one idea, and there's no golden bullet or utopia. It's about doing lots of different things. It's about looking at that prevention and self-care agenda. It is about how do we reduce inefficiencies in the system to make things much more joined up for patients, but also for clinicians, so that they're not wasting time chasing referrals, chasing care, chasing results. How do we use technology to share data more effectively between services? How do we make sure that the services that we've got are sustainable, are able to work to the hours that we want them to be able to do, to be able to make sure that people know where to go and are easily able to understand what's local to them and to do those. And also, how do we make sure that the money that we are spending on the back office, on administration, is the minimum that we need, so we have more to deliver patient care. So it's a journey that we've been on over the last 6 to 9 months. We've been in darkened rooms with towels over our heads trying to work through this, but we will be able to talk through more effectively and have that local engagement about what these plans mean for people. But for us, it's only partly the journey we've already been on in terms of some of the changes that we've made. Nationally, you may have heard that people are concerned that it's going to mean, huge changes to services. I think we in Hertfordshire have already made significant changes. There's more we can do, but I think it's more a continuum rather than something that will come out of the blue. This is a journey we've been on, and we're just taking it forward. And I shall hand on to Pauline.